My name is Dr. Buonassisi, and I'm a board-certified facial plastic surgeon with a practice in Vancouver, Canada. I've been specializing in cosmetic rhinoplasty for almost 20 years, and I'm here to answer your questions about this very interesting procedure. Happy patients are educated patients, and that's why every question is a good one.
So what makes a patient a candidate for surgery? I think you have to think about it in terms of your own perspective. Are you a candidate for yourself? And does the surgeon feel that you're a candidate for surgery? So the issues that you have to think about for yourself are, is this procedure something that I really need? Do you have an irregularity on your nose, or do you have a shape to your nose that really doesn't suit you? Does making a small change to it really make a difference for you? The other is that, can you accept that your nose is probably not perfect now, and it probably won't be perfect after surgery? And is that something that you can live with? Do you have a reasonable attitude about what this procedure is going to do for you? Then you have to think about, from a surgeon's perspective, whether or not a surgeon feels that you should have this done. And that's really what being a candidate means. It means, is this a good idea? Should you have a surgery like this? Perhaps you shouldn't. From a surgeon's perspective, we want to make sure that the changes a patient wants to make to their nose are actually possible. They don't, defy the laws of physics. There are things that rhinoplasty is really good at. For example, taking down a bridge, or making a hump smaller, bringing a tip up, changing the angles of a nose on a patient's face. What it's not good at all is making someone with thick skin have thin skin. It doesn't do that. Surgery is there to change the framework of the nose, but has no potential to change someone's skin. So if you've decided that you think you're a candidate, then you have to be open-minded about discussing your surgery with the surgeon, because the surgeon ultimately needs to decide if you're a candidate for surgery or not. So there's 4 things that I look at to determine if I think a patient is a candidate for surgery. So the first thing I look at is whether or not a person is healthy enough to have surgery. And I think that's both physically healthy, but also emotionally healthy enough to have this done. For that reason, we're a little bit cautious about suggesting rhinoplasty in patients who are too young, because we're not entirely sure that they're emotionally ready for that. Being physically ready really just means that you're healthy and that you're not going to have undue risk having an anesthetic or complications from surgery because of your underlying health. The second thing I'm looking for when I assess candidacy is whether or not somebody really understands the benefit of surgery and truly understands the risk. I want people to listen when I'm talking about the risks. There are medical and there are cosmetic risks with rhinoplasty, and I need to believe that they've taken the time to understand those risks. That's a very big discussion when talking about the benefits and risks of surgery, and that's something that we would cover in greater detail in another video. The third thing is that patients have realistic expectations for what a rhinoplasty is going to do for them. A rhinoplasty is going to change their nose. It's not going to change their life. And I think if they realize that and they understand that, that's a much healthier way to go into the surgery. In addition to that, I want us to both be on the same page about the types of changes that can realistically be made. The way I find the most helpful to achieve that is to do computer imaging on their photos. Rather than having a patient come in with someone else's nose and saying, well, I want to look like that. I think what works best is for me to make some modifications to their nose with a computer imaging program so that they can see what a new nose on their face would look like. And I think that's really the best way for someone to assess whether or not they like their new look. And if we're on the same page in that I'm showing them features that I can change realistically with surgery, and they like the way those look, then I think that's probably a good fit. The last thing is that a good candidate for rhinoplasty is someone that really needs to have a rhinoplasty. And that, in the end, it is partly a decision that I have to make, but also partly a decision that patients need to think long and hard about. There are some features, when changed, categorically make noses look better. And I think they're fairly universal. There are some features that, when changed, make noses look different, but not necessarily better. And I think we need to avoid those types of things. So if someone has a very particular shape or very particular feature that they want to bring out in their nose, but it's not classically, an aesthetically pleasing feature, or it isn't going to necessarily make the nose look better in general, I would avoid suggesting surgery in cases like that. I always find it very difficult to say no to patients. They've often thought that having a rhinoplasty was going to make a big change to their nose or a big change to their life. But I think if a surgeon says no to you when you're requesting a rhinoplasty or any other type of cosmetic surgery, you should really look at that as them doing you a favor. We really are in no rush to operate on people that aren't going to have a significant benefit. And I think it's to the patient's detriment in the end to have surgery that they don't really need.
Thanks for listening, and check back regularly for new questions and my honest answers about rhinoplasty.